Welcome to the Preparing for Surgery class, which aims to provide you with information on how to best prepare for your upcoming surgery at the South West London Elective Orthopaedic Centre. The Lifebox Health Questionnaire will be used prior to your surgery for your pre-operative assessment. Next, you will go through an assessment over the phone with a pre-assessment nurse to thoroughly review your health status and optimize any existing health conditions. You will also come in for a face-to-face appointment, where you will have your observations checked, an ECG, MRSA swab, and some blood tests. If you are awaiting any investigations, we will need a clinic letter of clearance before proceeding further. Also, if there are any changes in your health status or medications, you will need to inform us. Once the assessment has been successfully completed, and if we have no other concerns, you will be given a date for surgery. Around 2 to 4 days before surgery, you will receive a phone call from our pre-theatre team, who will give you information regarding your admission time, fasting instructions, and what medications you should or should not take prior to admission. You will have an opportunity to discuss any concerns. Have your symptoms improved? Have you changed your mind about having the surgery? Call us and let us know as soon as possible, as we will be able to offer your slot to someone who might benefit from the surgery. We will be able to refer you for an appointment with your consultant instead.
To help you get fit for the upcoming surgery, please practice the following. Eat a healthy and balanced diet, which will help your body to heal well in the post-operative period. Maintain good hydration, with around 1.5 to 2 litres of a variety of fluids per day, unless you have been advised to restrict your fluid intake. Reduce or stop cigarette or vape use, as well as alcohol consumption to prevent complications after joint replacement surgery. Keep active. Follow exercises on the patient journey booklet that was sent to you, and familiarise yourself with them. Look after your skin on the days leading to surgery to minimise the chances of infection to your new joint. Take extra care of your skin on the days leading to surgery, especially if you are outside at work or gardening where there is a risk of injury or insect bites to the skin. Wear cover-ups and use insect repellent where possible. If you develop any cuts, breaks or grazes, rashes, bites, bruises, ulcers, dry skin, or any other issues in relation to your skin on any part of your body, or a flare-up of any pre-existing skin issues, you must let the pre-surgery team know by contacting them as soon as possible. Please be aware that if you have any skin issues, it is highly likely that your surgery will be cancelled or postponed on the day. Avoid removing any hair from the site of surgery by shaving or waxing in the 10 days prior to surgery. Visit your dentist prior to the surgery, particularly if you haven't had a recent checkup or if you have a concern about your teeth or gums. Get plenty of rest in the lead-up to the operation and avoid major house renovations or other projects that are physically tiring. Ensure you have enough supply of your regular medication and bring them in their original box. To reduce the risk of infection in your new joint, you need to follow the protocol of octinison antimicrobial body and hair wash, as well as the nasal gel, which will be given to you with written instructions at the preoperative assessment. The regime is a continuous 5-day program. Start 3 days prior to the surgery date. Continue to use on the day of surgery, and 1 more day after the surgery. Use the nasal gel twice a day. Use the body wash once a day. And wash your hair twice before the date of surgery. Please read the instructions that come with the pack.
Ensure that you prepare your home. Have a look at the space around your bed and the living areas. Ensure there are no loose rugs, electrical cords, or other trip hazards before coming in for your operation. Think about any assistive devices or equipment that might help you after the surgery, such as hand grabbers, long-handle shoehorns, or sock aids. Also, we may provide you with a raised toilet seat if your toilets are too low. After hip replacement surgery, you will need to avoid extreme movement of the hip joint for the first 6 weeks. For example, you should avoid bending down to the feet to put socks or shoes on and sitting on low chairs or stools for 6 weeks. Please contact the discharge team if you have any questions or concerns in relation to preparing your home prior to the operation. On the day of surgery, you will arrive at the reception where you will check in with the receptionist. You will then be taken to the pre-theatre department, where you will get changed into a hospital gown, and the nursing team will do further assessments to ensure your safety. The anaesthetist and surgeon will speak to you separately regarding the type of anesthesia, the surgery, and to obtain your consent. Once the theatre team is ready, you will walk, if you are able, with a staff member into the theatre. A wheelchair will be provided if needed. You will be asked to confirm all your details again, your anesthetics will be given, and your surgery will be performed.
The following animation will show you how a total hip replacement is performed. Feel free to replay this section as many times as you need. Your hip joint has two bones that fit together like a ball and a socket. The ball is the top of your femur or thigh bone called the femoral head. And the socket in your pelvis is called the acetabulum. A total hip replacement is usually done if you have severe pain caused by arthritis, injury, or other diseases that damage your hip. During the procedure, your hip joint will be replaced with new, man-made parts called the prosthesis. The socket part of the prosthesis is a cup called the acetabular component, and the ball part is called the femoral component. To start the procedure, your surgeon will make an incision over your hip. The position of the incision will differ depending upon the approach used by the surgeon, such as posterior, lateral, or anterior. Once your hip joint is reached, your surgeon will dislocate your hip joint. Any damaged cartilage or bone in the acetabulum will be removed. The socket, which may be deformed, will be reshaped to fit the acetabular component. Then the acetabular component will be placed in the socket. Special cement or screws may be used to hold it in place. To prepare the femur, your surgeon will remove the femoral head. The cut end will be shaped to fit the femoral component. Then the femoral component will be inserted into your femur. It may be held in place with cement. At this point, your surgeon will put the ball of the femoral component into the new socket. With your new hip joint in place, your surgeon will test its motion and stability. At the end of the procedure, your incision will be closed with stitches or staples.
After your operation, you will initially recover in the post-anesthetic care unit, otherwise known as the recovery area. You will be closely monitored until you are stable and ready to move. Some patients might need to stay in the recovery area for a longer period due to underlying health conditions. Some, however, might be discharged directly from here. If you move to the post-operative ward, you will be looked after by a team of nurses and physiotherapists. Your pain levels will be regularly monitored and managed. You will be assessed and supported to mobilize to ensure you are ready for discharge. Most patients are discharged on the day of surgery. However, if you are not ready, you will be discharged on the following morning. You will need to think about who will be collecting you from the hospital and who will stay with you overnight at home. The nurses will provide you with discharge information. If you have any questions, concerns, or do not understand any of the information, please do contact us. It is now a common practice for patients to go home on the day of surgery, following hip and knee replacements. We will ensure that you are safe to go home following thorough assessments by medical, nursing, and physiotherapy teams. If you have any concerns regarding this, please speak to one of the pre-assessment nurses. We will now provide you with a brief explanation of what to expect after your surgery. Your active involvement is the key to a successful recovery. On the day of surgery, you will be assisted out of the bed by physiotherapy or nursing staff, and you are encouraged to mobilize frequently thereafter. Our team will support you in getting washed and dressed, getting in and out of bed, as well as to sit out in a chair for your meals, which are an important part of your rehabilitation and will enable you to determine if you can manage this when you get home. You will need to continue having a balanced diet and ensure you are well hydrated. A post-operative drink known as Fortisip Compact Protein will be given to you in the recovery unit, which will support the nutritional requirements during the initial period after your surgery. Make sure you continue to exercise in between your physiotherapy sessions. As soon as you can walk safely with a suitable walking aid and manage to transfer on and off the bed, chair, and toilet, and manage the stairs, you will be able to go home. How can you support yourself after surgery? Your mobility will be limited, so think about arranging help with shopping or ordering your shopping online. Think about stocking up some ready meals that you can microwave. Remember, you may be going home with 2 walking sticks or crutches after hip surgery. This will make it difficult to move food and drinks from one room to another. You may want to use a rucksack and a flask to move hot food and drinks from room to room whilst using your crutches. We will now look at the common post-operative symptoms and their management. Some pain and swelling are expected after your operation. You can help yourself through regular rest, ice packs, and raising your limb with support. Please see the pictures here as a guide to raising your leg following hip replacement surgery. You need to continue taking the pain medications provided to you. Once you are home, have a look at the list of pain medication given to you and the time you had your last dose of medication. Thereafter, plan your pain medication on regular intervals as explained during discharge. It is strongly advised that you take your pain-killing medication regularly for the first 2 to 5 days following surgery when you get home. Continue your exercises as these will also help in reducing pain and swelling. After your hip replacement, appointments with the outpatient physiotherapy team are made only if necessary. You are expected to continue the exercises explained to you by the physiotherapy team at discharge. If you have concerns after discharge, please contact the SWLEOC physiotherapy team.
Falling after your operation can be very traumatic and impacts your recovery. Following your operation, you would have been told what walking aid to use when mobilizing, and if it is safe to mobilize by yourself. If you feel unsure or unsafe to mobilize, please use the call bell provided to call us. In addition, when coming into the hospital, remember to bring in your glasses, hearing aids if needed, and well-fitting shoes with back support to ensure you are safe whilst mobilizing. Exercise and regular walking are vital in preventing blood clots. We aim to mobilize you as soon as possible after your operation. You must also ensure that you are drinking plenty of a variety of fluids. An anticoagulant, otherwise known as blood-thinning medication, will be prescribed to you after the surgery. It is important that you take these medications until the specified date to minimize the risk of blood clot formation. You will be provided with 4 to 5 days' supply of strong pain relief to take home after the operation. You will need to contact your GP if you require further supply of strong pain relief. Please note that you will need to take or email your copy of the discharge TTO prescription letter to your GP. Other medications such as anticoagulants, which are blood-thinning medications, anti-sickness, and laxatives will also be provided. Nausea and vomiting could be caused by anesthetic drugs or strong pain medications. We can prescribe anti-sickness medications to help you. Strong pain relief medication could cause constipation. You'll be given medications called laxatives to help manage your bowels. In addition to this, you need to drink plenty of water. Add some wheat bran, oats or linseed into your diet to stay regular and increase your mobility. We will now show you what to expect after your operation and when you need to be concerned and contact us. The first column shows the normal signs of recovery and the second column explains when to be concerned. You might have moderate to severe pain, joint stiffness, swelling on the operated limb, and a large amount of bruising. You can see an example here. As shown, the bruising may extend to the whole limb, which is quite normal. We would want you to contact us if you are struggling to put weight on the operated leg with the support of your walking aid, if you are experiencing a dramatic deterioration in terms of your progress, if you fall or sustain any injury to the operated limb, and if the swelling doesn't improve with regular ice and elevation. Additionally, if you are limping after 4 to 6 weeks while weaning off the crutches, you should contact us so the physiotherapy team can assess you further. In terms of the wound, it is normal for the skin to feel warm to touch around the operated area. There may be some skin redness localized to the wound site. An occasional small amount of oozing is expected on the dressing. If you experience pronounced redness or increased heat around the wound site, or shiny skin down the front of the shin, if the calf is swollen, hot to touch and painful when squeezed, large blisters around the dressing site, or if you experience extensive oozing, bleeding, discolored, or foul-smelling discharge from the wound, you must contact us immediately.
Thank you for watching the video. Feel free to replay this as many times as you like.
We encourage you to go through the frequently asked questions on Lifebox, as well as our website for more videos on procedures.